Enter the world of pharmacy. It held in world supremacy.
Bismillahirrahmanirrahim. Assalamu alaikum, dear viewers of my YouTube channel The Easy Pharmacology and my Facebook page Dr. Syed Mubashir Official. I welcome you all in lecture number 3, and the contents of my lecture number 3 is difference between the drug and medicine. I have told you people in my previous 2 lectures about the discussion all about the drugs. What is the drug? Today I will try my best to give you information that is there any difference between these 2 terms, the medicine and the drug. So let us start. What is the difference between them? I had told you people about the drug. So let us start from first. Any natural source from which collection and drying. From any natural source, either plant, either animal or any other source. Okay. Collection and drying. If you remember that after collection and drying, these 2 stages, what we get? Crude drug. Crude drug. And I had told you people that crude drug is what? This is the unrefined drug. And after refining process, what we get? The pure drug or refined drug. Okay. If you people remember up to this one, then you may get the point what I want to tell you people about the medicine. From natural source, collection and drying, we are getting the crude drug. This is the unrefined. After refining process, we get the refined drug or the pure drug. Here a question may arise in your mind that, sir, you had told us that the crude drug possesses the pharmacological activity. Then why there is the need to go for this refining process to get a refined drug? If this itself possesses the pharmacological activity, then obviously if we are administering this drug, then this may show its effect. Then why there is the need to go from this process of refining? Because obviously this may be time consuming, costly. So why there is the need? So there are so many factors amongst which if I am going to tell you few of them, then crude drug, you people know that the crude drug is what? This is a mixture of so many components, so many ingredients. Let's suppose if I had told you the example of digitalis lanata, there is the leaf of dried leaf of digitalis lanata. Okay, so this is what? This is a crude drug. But the crude drug, this is a mixture of so many components. The use of this digitalis lanata is what? The dried leaf of digitalis lanata is what? This is a cardiotonic. So there are so many components amongst which 1 or 2 or more than 2 may be used as a cardiotonic. Okay, but what about the other components? So there is a mixture of components. That's why there is the need to refine this drug to get that required component which has its effect on the heart as the cardiotonic. Okay, this is one of the reason, because this is a mixture, so many components. One may have the effect on heart, but the other components may have effects on other body parts. They may have the other therapeutic uses. So why there is the need? If I am administering the dried leaf, that is the crude drug, dried leaf of the digitalis. Okay, for which purpose? For cardiotonic. Okay, but that dried leaf is also containing the other components which may have the effect on other body parts. So here there is the need to refine this drug to get that pure drug, pure one component which has a therapeutic effect on our heart. This is one of the reasons to go for this refining process. Number 2, obviously there are so many components present in this one. Each component have the different concentration, different quantities. Okay, so that quantities, that amounts may have the effect on our body. So there is the need to get that one pure drug for which there is the effect on the heart. Okay, so this is one of the reason. Okay, after getting this pure drug, pure drug, mostly the pure drugs are in the form of this one crystalline or amorphous form, white crystalline or amorphous form. After refining, what we get the pure drugs. Mostly the pure drugs are in the form of what? The crystalline form or the amorphous form, white. Mostly these are present in this form. Okay. Let's suppose this is in the crystalline powder form. Okay. Now here, if I am going to ask you people that this powder form, this is also one of the drug. This can be administered in our body orally. If I am getting the example of from this dried leaf of Digitalis lanata, I am getting the pure drug digoxin. Okay. Digoxin is what? That one component, one ingredient which I have separated, isolated in the pure form. And digoxin is in which form? Let's suppose this is white crystalline or amorphous form. Let's suppose. Okay. Now digoxin, the therapeutic activity of the digoxin is what? The cardiotonic. Okay. I am getting digoxin some amount orally. But if there is a need the need of injection, then how can I take this digoxin? Because this is present in crystalline amorphous form, then how can I administer through the injection? If there is a need to, let's suppose there is an other any pure form drug, other drug, there is a need to apply topically, then how can I apply topically? If there is a need to take this drug, pure drug, through rectal route, if there is a need to take the inhalation route, if there is a need to transfer the drug into the blood through transdermal route. So this pure form, what I want to tell you people, that this pure drug in which this is present, white crystalline form. So this form of the drug is not suitable to administer in our body through different routes. So this is not that suitable form. Crude drug, the issue with the crude drug is what? That this is a mixture. That's why this is not appropriate to use the crude drug, because this is containing so many components. So here in this case there is a need to purify the drug. Now we have purified the drug. Now here the issue arises what? That if there is a need to administer the drug through injection form, through topical route, through rectal route, through nasal route, through inhalation route, so how can we administer the drug through all these routes? So here the issue also arises. So here the need is what? That we should transform this pure drug in such a form which should be conveniently administered in our body. मतलब ये जो form है drug की, this is not in that suitable form to administer, to take in our body through all routes as per the need of the treatment. Okay, so here there is the need. Now this is in pure form. Okay, mostly in white or crystalline or amorphous form. Here is the need that we should convert this form of the drug in such a form which should be conveniently, easily safely, effectively can be administered in our body through all routes as per the need of the requirement of the treatment. Okay, so how can we do this one? So through this, when there was this need, then there is the branch of pharmacy, there is the discipline of pharmacy which came into being, and that discipline, that science, that branch of pharmacy is known as pharmaceutics. Pharmaceutics. Now here is the actual point. This was all the background which just I told you people, that from the natural source we got the crude drug. The issue with the crude drug was that this is a mixture containing so many compounds, so many components in different proportions, in different quantities. Okay, so since so many time the crude drugs have been used, since so many time the crude drugs have been used, they are administered in our body. Okay, but there is the issue with this drug, that this is the mixture component in different quantities. So in this case there is the need to purify this one. Now we have purified, but here the second issue arises, that this form, purified form, we can't administer as per the need. Okay, so now here is another need, that this pure form should be converted in such a form which can be conveniently, safely and effectively administered in our body. So this need, to fulfill this need, to convert this pure form in such a form, such a suitable form. Now pay your attention here. To convert, to transform this pure form of drug in such a suitable form, there is the need of a process, there is the need of something that can transform, that can convert this pure form into such a suitable form. So that process, or that science, that knowledge, that technique is known as the pharmaceutics. Pharmaceutics is what? This is also, if I am going to tell you the definition of pharmaceutics, listen. Pharmaceutics is the discipline or the branch of pharmacy, okay, which deals with the process of converting a new chemical entity or the old drug into a medication to be used safely and effectively by human being. This is the complete definition of the pharmaceutics. Okay, this is the science. This science came into being. This science came into being to fulfill, to overcome this problem. Which problem? To convert this pure form in such a suitable form that form of the drug can be conveniently, safely, effectively used by human being. Okay, so to overcome this issue, the science of the branch of pharmacy came into being. That branch, that science of pharmacy is known as the pharmaceutics. I told you the definition of pharmaceutics. Okay, simply if I am going to tell you the definition of pharmaceutics, the science of dosage, form, design. Okay, now come to discuss it in detail. Pure form of drug. Pure form means isolated, refined form of the drug. Okay, there is the need of a process. There is the need of a process to convert this pure form of drug in such a suitable form. I am writing down here a word, suitable form. Okay, this is the pure form of the drug, and there is the need of a process, a technique, okay, to convert this one in such a suitable form. Which suitable form? Any suitable form which can be easily, conveniently, safely, effectively used by human being. Okay, simply now come to the main point. This is drug, okay, and its that suitable form is known as medicine. This is the drug and this is the medicine. Medicine is what? Simply, if I am going to tell you, any suitable form of the drug, suitable form of the drug which may be conveniently administered to human being. Further, if I am going to tell you the definition of medicine, now come to understand. Pharmaceutical preparation of drug to be used by human. Actually, this is the definition of medicine. I have told you the definition of drug. What is drug? And the difference between drug and medicine is what? Medicine is what? Pharmaceutical preparation of drug to be used by human. This is one of the definition. But if simply I am going to tell you any suitable form of the drug which can be conveniently, easily, effectively used by the human being. Further definition, what is medicine? Physical state, any physical suitable state of the drug. Okay. Further, if I am going to tell you the definition of the medicine, these are the pharmaceutical drug products, in any form which are marketed for use in human, having a proportion of active pharmaceutical ingredient and excipients with a suitable dose. This is also one of the definition of the medicine. But for your understanding, simply the difference between the drug and medicine is what? The medicine is any suitable form of the drug which is conveniently, safely and effectively used by the human being. Okay. I have told you that the pharmaceutical preparation of the drug. Why I have used this pharmaceutical preparation? Because in between the drug and the medicine there is one process involved, one science, one technique. That technique or science or discipline is known as the pharmaceutics. So when any drug crosses the pharmaceutics, this drug becomes medicine. Before pharmaceutics, that chemical is known as drug. After pharmaceutics, it is known as the medicine. So you can say all medicines are the drugs. All medicines are the drugs. But the suitable form of the drug, pharmaceutical preparation of the drug. If I am going to tell you the other names of medicine, you may write down pharmaceutical preparation. Okay. Other names of the medicine: pharmaceutical preparation, pharmaceutical formulation, or pharmaceutical drug. It is also known as the other names which may be used for the word medicine. Pharmaceutical preparation, pharmaceutical drug. This is drug. Medicine is what? Pharmaceutical drug. Because pharmaceutics is that discipline, is that process which has converted this medicine into, or this drug into medicine. So it is also known as a pharmaceutical drug. Other names are also there. Dosage form. You may also use dosage form. Somewhere it is also said that you may also call it the unit doses. Unit unit doses. You may also call it medication. So these all are the terms which are used for the word medicine. Pharmaceutical preparation, pharmaceutical formulation, pharmaceutical drug, dosage form, unit doses, medication. These all are the terms which are used for the word medicine. Okay. Before pharmaceutics it is drug, after pharmaceutics it becomes medicine. Okay, here the question arises that what is that technique which the pharmaceutics is using to make a drug as a medicine. Okay, come on to understand that one. Drug plus, okay, I have draw an arrow. Arrow shows the process of pharmaceutics. One thing more, pharmaceutics, drug when passes through the pharmaceutics. So obviously there should be any premises, any location, any area where there is the science of pharmaceutics is implemented, is applied. So that location, that plant, that area or that premises are known as the pharmaceutical company. So when drug had not entered into pharmaceutical company, it was known as the drug. Any chemical before the entry, we may call it, before entry into pharmaceutical company, that chemical was known as a drug. After entry into the pharmaceutical company, that chemical is now known as the medicine. So pharmaceutical field is applied, is implemented in an area. That area is known as the pharmaceutical plant, pharmaceutical company. Okay, so what happens with the drug in that company? Pharmaceutics is doing what process? Which process? So what the pharmaceutics do with this drug? It adds excipients. The function of pharmaceutics is to add the excipients with the drug to make it the medicine. To make it the, or you may also call it, medicine is what? Medicine is a decorated form of the drug. Decorated. The excipients, these are also the chemicals. These chemicals are added or mixed. These excipients or chemicals are added or mixed with drug, the pure drug, to make it the medicine. And medicine is what? Any suitable form which is conveniently administered to the human being. Now excipients, what does mean by excipients? There are so many types of the excipients which are added with the drug to make it the medicine. There are so many types, there are so many classes. I am just writing down here few of the examples. Diluents, okay, solvents, binders, disintegrators, stabilizers, etc. There are so many classes of the excipients. Excipients are also the chemicals, the substances which are mixed with this one, okay, with the drug, the pure drug, to make it the medicine. Okay. Now here the drug may be single or maybe the mixture of two or more. the mixture of 2 or more drugs. These are mixed with these one to make it the medicine. These all are the categories. Diluents to make it dilute. Solvents, binders like the tablet, the powder, the granules are going to bind with each other to make it a tablet. The disintegrators to make the tablet disintegrate. When we are going to take the tablet, administer the tablet orally, when it comes in contact with the stomach, then it disintegrate. Okay, stabilizers. There are so many types of the stabilizer. I am not going into deep. What my point is, what to make your concepts clear between the drug and the medicine. Okay, now I am calling the medicine as the suitable form. Now here question arises, sir, which form? Now there are so many types of the medicines. There are so many types. If I am going to categorize the medicine on the basis of the physical form, so there are few types. Number one, the medicine may be in liquid form. Okay, it may be in semi liquid form, it may be in semi solid form, it may be in solid form, or it may also be in gaseous form. Okay, on the basis of the physical parameters, the medicine may be in liquid form and semi liquid form and semi solid form, gaseous form. If you are going to ask a question, let's say any example of this one, if I am going to quote the example of liquid form of the medicine like syrups. Now this pure drug when it was in pure form and crystalline or amorphous form, now if we will add in it with the diluents or the solvents, liquid solvents, okay, then it may become a liquid dosage form, liquid medicine, liquid pharmaceutical drug, liquid pharmaceutical preparation, liquid unit doses. Okay, so the example of liquid form is syrup, one of the example of syrup. Okay, semi-liquid, the example of semi-liquid medicine is what? Like the lotion is what? Semi-liquid. Okay, lotion is semi-liquid. There are also the other example, semi-liquid, and there is also the example of semi-solid, like the ointment. Ointment is one of that medicine which is physical form, semi-solid form. Ointment. Okay, solid form like tablet, capsule, these are in the solid form. Tablet. Okay, gaseous form, aerosols are the examples of solid form. Okay, so these are the few examples of the medicines categorized on the basis of their physical parameters, physical appearance. Okay, so hope that you have understood the difference between the drug and the medicine. The drug is in pure form. When it crosses the pharmaceutics, it becomes the medicine. We may say that the pharmaceutics makes the drug capable, makes the drug able to be used safely and effectively and conveniently. Now here the question arises, sir, you are repeating these words safely, effectively, what does it mean? Because I have told you the definition of medicine, that it is containing the mixture of active pharmaceutical ingredients and excipients in a proper dose. When I have told you the example of crude drug, if I am going to administer the dried leaf of digitalis, Lenata, now I don't know that how much quantity of digoxin is present in that one. Maybe the dose which is appropriate for my cardiac function, okay, maybe the crude drug may not be containing such dose. it may be containing that so that higher dose may be toxic for the heart. So that's why the medicines are containing the proper, the accurate, the therapeutic dose. That's why for the medicine the word is used the safely administered. Conveniently, what does mean by conveniently? Let's suppose if any pure drug has a bad smell, has a bad taste, so their bad smell and bad taste are masked by different sweeteners, different flavors, and they are added, because what I have told you about the excipients are also containing the sweeteners, excipients are also containing the flavors. So the flavors are added with the pure drug, the sweeteners are added with the pure drug to mask its bad smell or bad taste, to make it in such a form, such a suitable form which is conveniently administered by the patient. So these are the reasons why I have used the word the safely and the conveniently. And what does mean by effectively? Because these all excipients makes it able to be administered in such a way that it is effectively producing its effects in our body. One thing more which I want to tell you people, that in a medicine is what? Is composed of, medicine is composed of drug plus excipients. Okay? In a medicine, there are two components. Number one, the drug. The number two, the excipients. I have told you people about the definition of drug, that any chemical substance which possesses the pharmacological activity. That's why in medicine the drug is also known as API, Active Pharmaceutical Ingredient. Medicine is composed of two types of ingredients, the drug and the excipients. The drug is what? Which possesses the pharmacological activity. That's why this is known as API, Active Pharmaceutical Ingredient. It means that whatever the medicine we are administering in our body and it is showing its therapeutic effect, so that therapeutic effect is produced by this component. There are two components, drug and excipients. The therapeutic activity, therapeutic purpose is achieved by this component of the medicine, not by this one. These are just excipients, okay? These are just added in drug to make it in such a form which is conveniently, effectively and safely used by the human being. Now, what is the role of this one? So we may call it that, I may quote an example that there is a person which has the capability to do something, okay? But that person is saying you people that I can do this task for you, but I haven't the resources, I haven't the sources to reach at that position, at that premises to perform, to do that work. So can you please give me such resources to make me able, to make me eligible to reach up to there. Once if you people help me to make, once you people help me to for the richness over there, then I can do that task one. Okay, so likewise the drug is capable to do that work. The drug is capable to relieve the pain in our body. The drug is capable to relieve any function in our body, any pathophysiology of our body. But the drug says that I haven't the resources, I haven't the vehicle to go up to there, I haven't other resources to reach at that position of the body, to reach up to that tissue of the body, to reach up to that organ of the body. So the drug says that, can you please give me such kind of resources which make me able to reach up to there. Once you people help me to reach up to there safely and effectively, then I can do my work. So those resources are known as the excipients. Excipients are all those resources which we are providing to this drug. Then we are providing you these resources, then go along with these resources into body and show your effect. So these are just the resources or the vehicles or all those parameters which help this drug to reach up to its target. And further, the task, the function is of this drug to relieve the pain or for any therapeutic purpose which we are using. So the drug has that task to do that one, but these are just resources to make the drug eligible to reach up to that position, to that tissue, to that organ or that position. Okay, so these are just excipients which are helping this drug to do their task. So medicine is composed of drug and excipients. The drug is what? Active pharmaceutical ingredient. I have told you in the definition of the medicine that these are the pharmaceutical drug products in a form which are marketed for use by human being, consisting of the proportions of the active pharmaceutical ingredients and the excipients in a defined dose. So excipients are, we may call excipients that inactive. This is the active form, active ingredient, this is the inactive ingredient, and these are also known as inert substances. These also go along with the drug into our body, but these haven't any function, any pharmacological activity in our body. The pharmacological activity is only possessed by this one. These are free from the pharmacological activity. These are just help us to make the drugs eligible to reach up to that position. So these are free from pharmacological activity. That's why these are known as the inactive components of the medicine, and the active component of the medicine is known as drug. So we may say that any therapeutic effect possessed, exhibited by the medicine is due to this component, not by this component. Okay, so medicine is producing its therapeutic effect by the help of this component, not by this one. Okay, but if I say that the medicine can produce therapeutic effect without this component, if I say, then so this I will discuss in my coming lecture, in my lecture number 4, that is there any possibility that if we are excluding the drug, if I am excluding this component from the medicine, only I am keeping or remaining these components into the medicine, then is there any possibility that that form of the medicine may also produce a therapeutic effect? So is there any possibility? So inshallah in my next lecture we will sort out this issue, that is there any possibility to do that one. So inshallah we will be connected in our next lecture. Up to date, Allah Hafiz.
Enter the world of pharmacy.